I know there are spokes, there are hubs in a number of these connections. So, and our presenters are ready. You're welcome, Thomas, and welcome. So I take the opportunity to welcome all of us who have connected already for this November session. As you know, LabCoP is a community that is advocating for strengthening laboratory systems using viral load as a case or as an entry point into laboratory system strengthening. And we are looking at the viral load cascade right from demand creation to result utilization. And in between there are lots of cross-cutting issues. And today we are handling one of the cross-cutting issues that if you are doing viral load, you cannot escape from the demand for management of waste and safely disposing of waste in a way that that does not endanger the environment, neither does it endanger the staff working within the environment, within the labs and the nearby environment. So this is what we are going to be looking at today. One of the cross-cutting issues which comes from the laboratory, from the testing process within the lab. Lots of waste generated. If you are not speaking, you mute yourself. You mute yourself so we avoid the echo. The echo is coming from our end. Okay. So I take the opportunity to welcome all of us, and also welcome our presenters coming from the International Laboratory Branch, CDC Atlanta, who are going to be taking us through this session. Then after we will react, we are presenting. There was the form that I circulated about a day or so ago, which seeks to get feedback about the status of waste management within your countries, your respective countries. Please do fill that form and send it back. Make sure we have the form back before end of next week so that a plan can be drawn on how to support you. The International Laboratory Branch is coming up with a cascade of activities that will eventually ensure that countries are given the necessary information, knowledge and skills that will help them to safely manage waste. So your feedback will be very important in the way they plan, how to support you as a country. So please that feedback. So I take now the pressure. So the slide you see here is basically showing the cascade from demand creation. We've been handling issues for, this is almost a full year as we've been handling. So this is the first time we are handling issues related to waste management. So please, it's very critical, and I know it will be very informative that we are going to share in this session. So we will give our presenters about 20 minutes to present, 20 or so minutes to present, and then thereafter we'll react. Then we will have announcements at the end. We have a couple of announcements. As you know, the number of things that are in the pipeline, the ASLM Conference in Abuja, the satellite, and a couple of other things will come at the end. So I take the pleasure to welcome our presenters to take us. So Nicholas, you can share the slides and then we hand over. Okay, so put it on the slide, yeah. So the floor is yours, please, Steve and Tim.
So, good afternoon, everyone.
Yes, good afternoon.
My name is Thomas Stevens, and as Charles said, I'm with the CDC International Laboratory Branch. I am a health scientist, a biosafety professional, and I'll also let my colleague David Bressler introduce himself.
Hello, everyone. It's a pleasure to be addressing the LabCoP today. As Thomas said, my name is David Bressler. I am a certified biosafety professional and also a microbiologist here in the International Laboratory Branch at Centers for Disease Control in Atlanta.
So I guess we're going to say next slide.
Yeah.
Okay, it's there, sorry. So the presentation today, we're going to basically provide some background information on HIV-related healthcare waste disposal and some of the issues that we're seeing in many of these countries. We're also going to discuss some of the potential remediation technologies and consideration for this waste and how to manage this waste. David is going to talk a little bit about some of the sources and the different types of healthcare waste. He's also going to provide an overview of the WHO document on safe management of waste from healthcare activities. And then at the end, we're going to talk a little bit about a way forward. So after this training, what are we going to do from ILP on the next ECHO sessions, specifically dealing with healthcare waste. Next slide, please. So the purpose of this presentation and this ECHO training is basically, as Charles said, is to support the LabCoP, which focuses on the scale-up of HIV viral load testing and monitoring. We wanted to kind of take a deeper dive into specifically some of the growing waste management issues that we're seeing in some of these countries, specifically dealing with some of the solid and liquid waste, the chemical waste that are coming from these viral load platforms. We wanted to bring together some of the LabCoP country teams and experts like ourselves and other experts to come up with different strategies and methods for building on sustainable waste management systems in these countries. Next slide, please. So now I'm going to turn my focus a little bit more to providing an overview of viral load testing, waste management, and some of the issues and concerns that we see out there. Next slide. So by 2020, it's estimated that there will be more than 30 million HIV viral load tests that will be performed globally. We also estimated there will be about a million liters of effluent chemical waste and about 2 million kilograms of solid waste that would be produced in the year of 2020. Some of the concerns are some of these facilities are located in in low to middle income countries, and they may have some limited infrastructures and may have no existing waste management practices and policies and regulations in place. Countries have been asking, especially the International Laboratory Branch, about providing some guidelines on some of the methods of disposing of this waste, viral load waste. Next slide, please. So, familiar with the testing, the HIV viral load test, the molecular diagnostic test, and it also produces a chemical waste that contains GTC of 1-dinyl thiocyanate. This thiocyanate is toxic to humans and animals, and if it's untreated or even poured down the drain, where in many countries a lot of people are doing, it can basically pollute the waters and harm aquatic life. If it's mixed with bleach, it can produce a hydrogen cyanide gas, and that's where you see a lot of manufacturers of these platforms saying never to pour bleach in their waste containers, chemical waste containers. Next slide, please. Some of the country challenges and barriers. There are lack of waste management regulations and guidelines in place, and that's been a big issue. There are limited financial and human resources when it comes to supporting waste management systems. For example, buying incinerators, maintaining those incinerators. There are lack of technological infrastructure advancement, and there's always a shortage of local waste management technical expertise in countries. So most people are always asking, like, what do we do in this situation? How could we buy a certain type of technology, et cetera? Next slide, please. Here are some potential technologies in consideration for mainly the liquid waste for viral testing. Encapsulation is basically where you have a waste management company to come and pick the liquid waste up. It's basically collected in some type of container and drums. It's taken to a landfill site. At the landfill site, they usually store it. But, you know, some of the landfill sites, you know, some of these landfill sites, you know, they require a lot of land. You have to monitor these sites, make sure there's no leakage that goes into the soil and also the wastewater, and also the water stream. There are also a high temp incineration that some countries are using, like going to a cement kiln and bringing cement companies into the process of which this waste can be disposed. I think in Mozambique, they're looking into that option. But with incineration, it comes with a few different issues. It has to be made sure that it's monitored for emissions, making sure that you have no bad gases or anything going into the environment. And it has to be equipped and be able to basically dispose of the chemical waste. It can be very expensive, and it requires very skilled labor to run and maintain. And then you have to know the right ratio of basically adding the amount of liquid to the solid waste to make sure it doesn't drain out or pour out of the incinerator. Next slide, please.
Talking about waste
filtration is another device that can be used, and it's basically could be used to basically extract the chemical compounds prior to disposal. You need some type of filtration process and technology, and using some type of membrane. The membrane might be some type of charcoal membrane. It requires a large volumes of liquid. Sometimes you could have so much particulates, sediments in there that can kind of delay this process. And then also neutralization of the chemical compound, such as GTC or its byproducts. It can be treated, but it's to identify those products that could basically neutralize these chemicals before it can be disposed of properly. Next slide, please. Now I'm going to turn the slides over to my colleague, who's going to go into healthcare-related waste.
Once again, everyone, thank you for the opportunity to talk to the LabCoP this morning about waste, today about waste management. As Thomas mentioned and covered pretty well, the idea of waste associated with viral load and EID is something that's coming to the forefront now just because of the upscaling of the viral load situation. There's going to be a lot more waste that needs to be figured out how we're going to mitigate that. However, right now that's a small part of things if you consider the overall situation of healthcare related waste. And I'll try to cover a little bit on that today. Next slide. So one of the things that has to be considered are the major sources of healthcare waste. Obviously, hospitals and other healthcare facilities are probably the principal source of this waste, this type of waste, but laboratories and research centers, which we would probably be most familiar with here in this audience. But other considerations would be the mortuary and autopsy centers, animal research and testing laboratories, of course, blood banks and collection services are huge producers of plastic and contaminated blood waste, and something that most people do not consider are nursing homes for the elderly. They often have situations where a lot of healthcare waste is produced, and having to figure that out has become a sort of a tough task for everyone. The problem with healthcare waste is that the time isn't often taken, or the knowledge of how to separate hazardous from non-hazardous wastes in many countries, especially, it's not just Africa, it's most countries worldwide have the same situation, the US included. And trying to determine the real quantity of hazardous waste, because everything is mixed together, makes the job that much tougher. Next slide. So, types of healthcare waste that we're talking about. Obviously, the infectious waste, which is waste that would be contaminated with blood or other bodily fluids, cultures of infectious agents and materials that we would typically utilize in laboratories. Autopsy materials, infected animals is a huge source of waste. And from hospitals, the waste from patients with infections, the bandages, the needles, and things like that. Pathological waste is that type of waste that would come from autopsy and mortuary centers. This means human tissues, organs, body fluids, and for animal laboratories, contaminated animal carcasses. Sharps waste is one of the most critical issues out there for waste management. And obviously this is going to be things like syringes and needles that have been contaminated or used on patients. We think of scalpels and blades, but in other cases it may be broken glass that may have blood and things like that on it. Chemical waste for the viral load situation, we may be talking about mixed waste, which is waste with biological and chemical solutions mixed together. In the case of the viral load platforms, we'd be talking about whatever is used as part of the reagent of that platform being mixed together with the diagnostic specimens that are being run through that platform. So all of that being mixed together becomes a part of mixed waste and can be considered chemical waste as well. It also brings together solvents and other reagents that may be used in your laboratory, disinfectants, sterilizers, and even things like mercury from broken thermometers. Batteries are something that would be included in that as well. Next slide. Pharmaceutical waste means the expired or unused drugs that are often provided and people don't take them all. So something needs to be done with that. This also includes vaccines. Cytotoxic waste is the waste that may come from treatment of cancer patients. Those materials that may have genotoxic properties, things that may affect the DNA or RNA of cellular systems. Radioactive waste. This is something that, because there's been a tendency towards elimination of radiation in most countries for research, this type of waste has gone down quite drastically, but in many countries, radioactive materials are still being used in many things, and that material needs to be dealt with. And here, the last segment here is non-hazardous or general waste, and this pretty much constitutes most of the waste that's out there. However, since many countries do not separate or segregate their materials, everything then goes together in one pile, and once that occurs, everything then has to be considered as hazardous waste. Next slide. Okay, so the big thing here is, and what we want to spend some time on, is the WHO publication, Safe Management of Waste from Healthcare Activities. This is now in its second edition, came out in 2014. And one of the reasons the WHO has decided to put this together is because of the huge concerns over general waste and healthcare-related waste management. And so what WHO did was put together some official guidance on how to deal with it and what some of the best practices and recommendations from WHO are. So there are 15 chapters, and it covers everything concerning waste management. It goes over what the definitions are, the sources, how to characterize types of waste. Spends time covering the regulatory and policy issues that nations and countries should be looking at, how to plan the strategies for waste management in the future. It also covers healthcare waste minimization, as well as reusing certain portions of waste and recycling some materials as well. Chapter 7 covers the storage and handling and transport of waste, and Chapter 8 then deals with the treatment and disposal considerations, some of the items that Thomas was discussing. Chapter 9 deals with sewage and wastewater. Chapter 10 looks at something that most countries do not consider, which are the economic considerations of dealing with healthcare waste. Chapter 11 really spends a lot of time looking at best practices in the health and safety realm for healthcare personnel, the people that actually deal with the waste in the laboratory, healthcare personnel and waste workers, and how to keep them safe doing what they do. Chapter 12 looks at the hospital hygiene and infection control, in this case preventing infections or incidents with waste materials. Chapter 13 looks at the training and educational issues that should be dealt with for your personnel that have to be involved in these situations. Chapter 14 looks at waste management and emergencies, things like dealing with the production of infectious waste during outbreaks and other situations like that. And Chapter 15 really looks at the future considerations for healthcare waste management worldwide. And so this is a really good publication. We provide a link at the end of the presentation so you can take a look at it. And we will probably be referring to this document quite a bit as we go through the further trainings. Next slide. So there are some general guiding principles that WHO wants to put out there, really to provide a background so that people understand the significance, the hazards that this type of waste represents to the workers involved. And so they want to make sure that, as one of the guiding principles, that facilities and personnel really understand the nature of the hazards, whether it's biological, chemical, sharps injuries, or lifting heavy loads, or whatever. So a training component is really heavily stressed. Excuse me. They want to make sure that standards of waste, proper standards of waste management and best practices and procedures are put together by the facility and are implemented. We want to make sure that exposure prevention and control plans are in place. SOPs that deal with spills and reporting accidents and incidents are put together, and how to properly use personal protective equipment. Excuse me. Also, the policy and procedures for post-exposure prophylaxis, immunizations, etc. And they want to make sure that all workers are trained on the potential hazards and know how to deal with them. Next slide. Okay, so one of the things that WHO goes over within the document that they put together is protecting or preventing exposures from happening. And what they use is the hierarchy of controls. The hierarchy of controls is something that biosafety relies a lot on. And specifically, they're looking at excuse me again, looking at preventing exposures in the workplace. And the ways that they would do this are by first of all, eliminating the hazard, which means completely removing the hazard from the environment. And we'd be talking about making sure that sharps materials are removed from the workplace if that's possible, making sure that unnecessary injections are taken care of and not done, removing sharps, other sharps like broken glass from the laboratory as soon as possible. The next level would be engineering controls. And these are things that isolate or remove a hazard from the environment. And here we'd be talking about biosafety cabinets or controls like sharps containers, and making sure that those things are provided in the situation, using needles that would self-retract and self-blunt after they're used. The next level would be administrative controls, and these are policies that are put in place to limit the exposure to a hazard. Things like universal precautions, allocating specific resources to ensuring that there's an IBC in place, an institutional biosafety committee, or an infection control committee. These things demonstrate that the facility is willing to dedicate the time and effort and money to keeping their workers safe. Work practice controls is the next. These are controls that reduce exposure to occupational hazards by changing the behavior of the workers. This means that workers are instructed not to recap needles and things like that. Placing sharps containers in a easily locatable area of the laboratory, making sure that they're eye level, making sure that those sharps containers are never filled more than 3/4 full. Now, if you look at the little graphic I have there, the hierarchy of controls goes from most effective down to the least effective. And if you look, it says that PPE, personal protective equipment, is the least effective measure here. So you try everything else, and then the last barrier for your protection that you use should be PPE. But this means that the workers, if it is the last barrier, in separating them from the hazard, they have to know and be trained on how to utilize don and doff and deal with situations where their PPE may be compromised. So all of these things serve to prevent exposures from happening, and those are the hierarchy of controls. Next slide. So the key points here the WHO wants everyone to remember is that most healthcare waste is not hazardous. And that's kind of funny considering what we're talking about, but keep in mind that most of the healthcare waste is not infectious. And it's only because we're not segregating properly, or maybe not segregating our hazardous waste at all. And once it's not segregated properly, that means that all waste has to be considered to be hazardous. Another key point is we want to make sure that all of our medical staff and others are trained in how to use sharps, and make sure that we take care of any incorrect waste practices. That means for everyone, from the workers that clean the laboratory to the workers that supervise the laboratory. WHO wants to make sure that a responsible person is put in charge of all of the occupational health care at a facility. Somebody is responsible and accountable for that item. Obviously, all of this stuff cannot happen without a sufficient budget in place to really deal with situations. There has to be an allocation of time and money. And some budget considerations that may want to be put into the mix would be making sure that your waste segregation containers are budgeted for in the laboratory facility. Also making sure that training is budgeted for. The time and the money is dedicated to training your personnel, waste handlers, and other employees. One of the most important items on here is that WHO wants to make sure that there's a no blame approach to persons that, in this country we call them whistleblowers, but we want to make sure that anyone that sees a problem in the facility can approach their management with a no blame attitude, meaning that if that person comes to management and says he sees a problem or thinks there is a problem, that management does not go back on that employee. But it's really a way to encourage people to speak up and to be observant. And so WHO really wants to make that clear to everyone. Next slide. Okay, so as Thomas mentioned earlier, this is mainly a session to introduce and familiarize people with waste management, and the idea that there is a problem, and the problem isn't just for Africa, it's a problem for every country worldwide. And so what we're doing here is certainly not going to solve the problem, but we hope to introduce this as a way to start a discussion on waste management. And that means that this is a two-way street. We really want to hear from you at your country level. We recognize that maybe some of the people that are on the LabCoP session today may not be the personnel most responsible for laboratory waste in their country or in their laboratory. But what we would like to have happen is that for the next session, that you that are on this LabCoP call kind of think about what we're talking about and go back to your own facility and maybe discuss what you heard today with the folks at your laboratory, the most appropriate personnel at your laboratory that deal with waste or waste management or at the MOH. And we'd like to have those people involved in the next class. We want specifically the laboratory managers, the waste management personnel, biosafety and safety personnel, as well as the health, safety, and environment and MOH lab liaisons. We want you to review the situations at your own facility, what the general waste management issues and concerns are for you, what you've seen in the past and what you think may be happening in the future. And as we discussed at the beginning, with the upcoming scale up of viral load, what specific management challenges do you foresee for your own country? We'd like to hear from you about what that means to you. If possible, we'd like you to go back and review what your own country's waste management policies are, if they're available. And we'd like to maybe utilize that as a point of discussion for upcoming sessions. Charles, I think, also mentioned at the beginning that we will be sending out I think an email with a number of different questions regarding waste management. We would like to utilize those answers to provide a discussion starting point in the future. And so we'd like you to take some time to fill those questions in. Next slide. So we provided some references and resources. One is for WHO publication that we mentioned. WHO thought that this was important enough that they put together a summary document, just published it last year. We also provided some resources for the low and middle income waste management issues that are things that really need to be considered. And those resources are posted here for you to take a look at and review. Next slide. And I'll turn this over to Thomas just to give an overview of the upcoming ASLM conference.
Yes, thank you, David. So ASLM have a conference that's coming up. It's scheduled for December 10th through the 13th, 2018. And as part of the Integrated Diagnostic Consortium, we're having a waste management seminar, which is entitled Waste Management Strategies for HIV Viral Load and Early Infant Diagnosis. It is scheduled for Tuesday, the 11th December 2018. It's very early in the morning. That's the only time slot we could have. But it's going to be a very important seminar. We have a lot of stakeholders who are going to be there, from CDC, from Global Fund, WHO, CHI. So it's a variety of people, UNITAID. So it's a lot of individuals or stakeholders going to be there. So I really want to invite you out if you're going to be at this conference and come by this session and, let your voice be heard and bring any issue that you may have in country concerning viral EID waste management. Okay, thank you.
Wow. Okay, thank you. Thank you very much. That was terrific. I think there's been a lot to learn and to think about. So heads are rolling around this issue. It's a nagging problem, definitely for all country settings. I'm thinking about it critically brings a lot of questions. But thank you very much for laying the grounds. Definitely, as you've said, this is just laying the ground. A lot of work will need to be done moving forward on how really to come up with strategies for self-management. So I know during the discussion, there's been a number of questions that have been crossing people's minds, sent in questions on the chat, but others who have not managed to do so, you have the opportunity now. So we are going to have a session of about 10 to 15 minutes of reacting to the presentation in whichever form. So we can begin with maybe what is in the chat. Nicholas, were you tracking what is in the chat, or?
There are some questions in the chat. The first question is from Dr. Pasco. It goes to Thomas and David, and it says, what sector of the government is ultimately responsible to the development and implementation of regulations regarding waste management? If a facility tries to implement a waste management procedure, where should it look for guidance at national level? So that is the question from Dr. Pasco to Thomas and David. And then the other, and still from Dr. Pasco, is what would be a sufficient budget for waste management? Are there examples of countries that costed the budget at facility and national level? What would be a sufficient budget for waste management? Are there examples of countries that costed the budget at facility and national level? Yeah, those are the questions from the chat, and members can use the chat, ask questions, or they can raise up their hands if they want to share anything or any experience from their countries. Thank you very much, Chair.
Okay, so I think I heard what the first question is, and I'll repeat it. It was, just to make sure I got the question. Someone wants to know what section of the country government is specifically tasked to deal with waste management situations, is what I heard. And my idea for that would be that in most cases, it would be the Ministry of the Environment. They would normally be the ones that would be tasked to prevent waste from being, they would mainly be tasked to contain waste, to make sure that it doesn't get out into the water supply, the aquifers of the country, making sure that waste management regulations are put in place to contain the waste, to deal with, and that's going to be a little bit of a situation because they would only be putting in place regulations for environmental controls. In most cases, the people that would deal with waste management from the healthcare sector would also have some sort of input into keeping healthcare associated infections low. And so if a person is exposed to waste in some sort of situation, whether it be sticks with needles that's in the waste, or with sharps or something like that, then it may be the Ministry of Health that also gets involved with dealing with those regulations and putting them into place.
Okay, I can also ask, there's another question on how do you deal with waste, GeneXpert cartridges? How do you dispose of GeneXpert cartridges? I think countries are grappling with that. It's a decentralized setting. How is this dealt with? Maybe I can also ask one. Of course, your focus was on PEPFAR countries. And of course, they are not the only ones that generate waste. Countries do have need for waste management. What in particular has PEPFAR prepared for their countries, besides just a presentation or a training? Is there any strategy from PEPFAR and any allocated resources, any whether infrastructure or system-wise or whatever, as a plan that PEPFAR is coming out with for their respective countries. That other countries that are not supported by PEPFAR, what can they pick from that strategy that you're coming up with, and how can they be supported?
Okay, so let me answer the first question about the Gene Expert cartridges. I've seen some documentation from CEPID who mentioned that the cartridges should be incinerated with at least sustained temperatures of 1,000 Cs to make sure that the cartridges and the GTC within these cartridges are adequately destroyed. So some type of high temp incineration. So a burn pit won't be sufficient, or some of those other type of, I don't know, lack of better words, those brick and mortar incinerators. It just have to make sure that the temperature is maintained at 1,000 Cs for the cartridges, okay? The other question that you asked, Charles, you mentioned it was what PEPFAR is doing. I know from CDC, initially when this problem that we start seeing this problem within the countries, it brought us, we were a little bit concerned because for me, my personal experience, I saw a lot of people were just dumping the chemical waste down the sink. So initially we came back, and within CDC, we decided, okay, hey, we need to start to develop some guidance so we can issue to the country. That is still in the works. What we ran into was to really think through the process of disposing of this liquid, this chemical liquid waste, which was a bigger issue because every country is different. Some countries don't have certain systems in place. So we had to kind of come back and try to figure out how the best approach would be. So right now, what we're doing is we have developed a protocol and have identified 8 countries to be a part of this protocol. And we're gonna first start out and just try to get a survey of the land to see what countries are doing out there with their waste. And then we're hopefully from that protocol, we can basically collect information that we can share with the PEPFAR and saying, hey, this is a bigger issue. We're going to need additional support to try to deal with this bigger waste management problem. But again, it's in the infancy stages. Again, as I mentioned with the conference that we have coming up, we also have a IDC group, the IDC, which basically are looking into this problem right now and trying to come up with a solution from all of these different countries and try to see how we're going to move forward. So again, we don't have an answer right now because it's all different, but we need to make sure that we get everybody on the same page. So whatever we're going to move forward with dealing with this space, we can put out the proper guidance, and then countries could take this up and decide how they want to move forward. So hopefully that answers your question.
Yeah, Chair.
I'm seeing a hand by Dr. Pasco. Yes.
Yeah, thank you. Thank you, Thomas, for this explanation. Well, I guess to put things very simply, you know, in a country that needs to implement a waste management procedure, where does the money come from if there's no PEPFAR? Where normally in an ideal situation, you wouldn't like that PEPFAR pays for your waste management. So is that tax money? Is that some money that has to come from you raise the price of laboratory testing so that you manage to to take care of your waste? Where do you find the money, domestically to manage your waste? Do you have some recommendations?
So as we're trying to make, it's right now, PEPFAR is not funding this. It's not in our country operation plans right now to fund such an activity. We're hoping that when we bring more awareness to this issue, maybe in the future, I don't know, and I can't promise that because, as you know, PEPFAR has its priorities and initiatives. So hopefully in the future, maybe it might become such a big problem when we get it to the attention of the OGAC, and that this issue could be addressed. Again, there are some donors out there that could potentially fund some of these activities. I know that we heard that Global Fund may have some money that dealing with, they're bringing incinerators in the countries. And again, and I hate to say this, but I'm going to say it, it's also, maybe within the country, you might be able to identify some resources from the Ministry of Health or within the local government to kind of fund and say, this is a big problem, and how could we help support this?
Yeah, but that's exactly, I'm sorry to be nagging, but that's exactly my question. So for example, in the US, where does that money come from in the country that has a system? Can you provide some guidance so that the other countries, would know where they have to look and where they have to ask? This is my question.
Yeah, like every like for within CDC or within our branch, we have our own budget for these activities. So all of this cost is basically built into the system. So if waste is an issue, like we have waste that's collected here, so our branch has to pay for that waste to be collected and transported to another facility to be processed. So again, it's built into our budgets. Yeah.
Hi, sorry, this is Kat Lehman. I just wanted to say that it's important that we don't rely on COP money or PEPFAR money, because PEPFAR is, as we all know, on short-term cycles. We don't know what's going to happen in the future. PEPFAR funding is reducing, and we want to make sure that this is a sustainable initiative. Some manufacturers have reached out and expressed an interest in providing some sort of financial support with this, but obviously we don't know what countries they are targeting. We don't know if it'll just be those countries that are using their reagents the most. And that is something that hopefully will be discussed during the ASLM waste management workshop.
Yeah. And Pascal, you can come to that workshop and bring all these. You'll
have I will. I'll come. I'll bring my question. Call on me.
Everyone there, just come with those questions. Just don't put me in the hot seat. I'm good. But just come and bring the questions, and that would be a good place because we'll have everyone there. So everyone who wants to answer this question, you can put it. We'll have PEPFAR OGAC there. So it'll be a good place to start that discussion.
And in addition, CDC has traditionally and will continue to provide technical assistance. So while that's not assurance for providing millions of dollars into the system for dealing with the process, as countries identify what resources they can gather to implement adequate waste disposal, we can offer things such as SOPs and guidance. And that's where actually the strength of CDC has lied, even in supporting PEPFAR. A lot of what we do is providing direct technical assistance. And I think what Thomas and David will be doing over the course of the next month is they're gathering the countries together. It's an opportunity for countries that do have something in place to be able to share, as we were in the last LabCoP meeting, South Africa offered, for instance, to share some of their procedures which were online and to provide that to the broader group. So starting with the dialogue and then moving from there, trying to develop strategies that would be implemented and work successfully in each particular country, which is different.
Yeah, and some countries may have good systems out there that they're in place and they can share it to other countries. And this is how we're basically dealing with this different type of waste, from the solids to liquid waste. So again, as Shirley said, and we're trying to say, it's just this opportunity to bring everyone together, and it might be something that we don't know. And we can say, oh, that's a good option that someone is using, and we can share it among the countries. But again, we're getting to that point, and hopefully very soon, as we continue to have these discussions, we'll have everyone on board and to find out how we're going to move this whole waste management piece forward. Because it's a bigger issue than PEPFAR or viral load or EID. Waste has been an issue in general in a lot of countries. So it's just, as you said, it's just not PEPFAR countries or PEPFAR or viral load or EID. It's waste across the whole entire, in laboratories, healthcare systems, etc. All right.
Okay. Okay. I think this is a very engaging discussion. Questions without definite answers. But it's good to begin the thinking. I think the meeting that is happening in Abuja is very timely, bringing the global audience to actually discuss the way forward and chart a way together would be very instrumental in this undertaking. I think that most of the technologies that generate this kind of waste are made by global players, by global stakeholders. So all these technology companies find it very hard to engage them at a country level. It's a global audience if they are put together and put to task to actually do like a social corporate responsibility to deal with this byproduct of their business. I think a momentum can be generated in coming up with a strategy that eventually can be able to impact countries. So I'm happy to learn that the technology companies are going to be part of the discussion. Like pharmaceutical companies always become part of the discussion. Let the technology companies discuss issues that are generated out of the technologies that they dish out into countries, because that's largely a product of their business. So I think that will be very strategic.
Yeah, we have one question in the chat. I don't know whether we should ask it. There is a question in the chat from someone
around waste management for Abbott reagents.
Yeah, how can we handle the waste? How can we handle the waste containing mercury, and for viral testing, especially Abbott reagents where there are no national regulations?
Do we want the presenters? Do you want to respond?
I think we have an issue with the waste containing mercury. I think for the viral load testing, that when I have Kat in here, I would think that the solid waste from the Abbott testing would be, as I said, some type of incineration. But the liquid waste, we can't pour it down the sink. So it's going to have to figure out a way how we could, as I said, there could be potential processes. There are some countries that are using maybe some type of kiln, like a cement kiln or some type of rotary kiln. But it would probably be some type of incineration process, but it has to be a balance of that liquid and solid and make sure that it is just not, it's just not poured down the sink. So again, every country is going to be different. So I think what we're doing at CDC, I guess, is for our liquid waste is being transported from to a waste management company, and then they're using some type of high temp incineration to get rid of that liquid waste.
So I'm not sure who asked that question, but I'm not sure where the mercury is coming from. So whoever asked that question, I have the Abbott SDSs in front of me, and there's no mention of mercury in the viral load reagents for Abbott. One thing about Abbott viral load and EID waste, it typically contains about twice the amount of GTC as other testing platforms. And it produces about twice the amount of liquid waste compared to other commonly used viral load testing platforms. So those countries that are using Abbott, you do get more waste. And like Thomas said, it's critical that the liquid waste is not poured down the sink, especially not with bleach. It should never be mixed with bleach. It should never be discarded with bleach. The liquid waste that comes off of these platforms is not infectious, but it does have chemicals in there that are of concern. So that is one misconception that I run into a lot in the field. People mix bleach with it thinking it's an infectious waste when it's not, and that's the worst thing that people can do.
Okay. So as we speak about this, we should not be speaking like it is something which is going to start happening. It's already happening. Mm-hmm. Where actually this waste is draining into sinks and water systems and so on. So we don't really need to be talking hypothetically. We need to be talking like we are having a crisis already, and very practical strategies need to be drawn in supporting countries to avert the crisis. Okay. So anyway, let us keep that for the for the. So nobody should miss that meeting. I think it will be a stormy discussion.
So one thing that a lot of countries are doing right now, where obviously they should not be pouring waste down the sink, but when they do pour it down the sink, they're making sure there is plenty of running water. So they're running it for a few minutes before they pour the waste down the sink, and then for at least 10 minutes afterwards. However, as you know, different countries have different amounts of water available, and so water flow, we still don't have any guidance on what would be needed to dilute, but again, that's not something that should be happening. Some countries are using charcoal, which is readily available, to mix with the liquid waste to solidify it. So the charcoal will absorb the liquid waste, and then it'll make it easier to transport. You can bury it, encapsulate it. That is something that is more widely available in the field, charcoal, compared to maybe cement mix or some of these fancier chemical compounds that we've been looking at that expand and solidify it. But it's not just the capturing of the liquid waste, it's also the transport that is an issue as well, keeping it safe, the right containers.
It's a whole entire system, so it's just not like you can't just come in and say this is how you're going to dispose it. You're going to have to strengthen the whole entire system.
Yes.
The collection point all the way to the disposal part of it, the transport, everything. So we just can't come in and say, hey, incineration is the best thing, but your entire system could still be broken.
It's not,
so you've got to start from the beginning. So it's just not, hey, get an incinerator. We have to look at the entire and build that system, or else we'll still run into these problems. When the incinerator is broken down, guess what? Then your waste is going to start continue to pile up. And then what do you do with the liquid waste? And then you have to depend on another donor to say, hey, we need another incinerator, but we can't process this waste. So if the incinerator is down, I've been in a lot of countries when the incinerator is down, the waste sits there for months. So if that's the case, then we got to build stronger systems. And if we build stronger systems, then I think this issue is going to go away. And again, you're going to need financial support, whatever, to build those systems.
Okay. Okay, thanks. I want to bring the discussion to a close. I know it's very intriguing, but since we have the Abuja meeting, let us keep some of these questions for the Abuja meeting. So this really is to invite all of us. None of us should miss that meeting because there'll be a lot to be discussed. So we are remaining with just a few minutes where we want to make some communication, some announcements. Of course, you know that just about a week or so to our meeting in Abuja. And all of us are welcome to attend the conference that begins on the 10th up to 13th of December. But of course, there are some meetings prior to that begin around the 8th. Those of us who are engaged, I think, are already aware about these pre-conference activities, where we also have the LabCoP satellite, which is happening on the 9th. So those of us who will be in Abuja, we book you already that on the 9th, please make sure you come to the Hilton Hotel. This is where the satellite is going to be. It's going to be a whole day event, and everything will be taken care of. You only need to come. And there is a lot of very interesting agenda that we are going to be handling through the day, especially working around the action planning and supporting countries with aligning action planning to funding and how to get these action plans implemented that we started working on while in Uganda. So please make sure you attend. I book you ahead of time. No excuse to miss. Of December, whole day you are booked. No other agenda on that day. So, the countries, you are being reminded to finalize your action plans, get in touch with your technical people to support you if you're stuck, and make sure by the 9th, our action plans are in good shape. you must have gotten communication about some adjustments in our flight and hotel booking for the country teams that are going to be supported by LabCoP. We are able to extend our days of stay, which was a positive thing. So please comply with the logistics team to make sure that you provide all the information that they are asking of you, to make sure that they do extend your booking for the hotel and adjust your flight booking so you can stay around for the rest of the conference. We have a budget constraints, and we are only going to have you up to the beginning of the main conference, but we had some adjustments within our budgeting, and we are able to take you on towards the end, if not the very end of the conference. So, which is a positive thing. Now, there's been a communication out on awards. I encourage country teams to actually go in and document your best practices that could be considered for awards. Go and go to the award page, read the guidance on how to register your best practices that would award that would be considered for awards. Write about people that you think have made outstanding contribution to laboratory transformation in your country, in Africa, and so on, for consideration of what their contribution is in form of recognizing them. Dr. Pasco, do you have a communication to make?
Yes, a very quick one. It's actually, I just have a comment for Thomas and David. Thank you for the excellent presentation. And you know that LabCoP is a community of practice, and we like to offer people like cooking recipes on how they have to solve their problem. And I could hear that there were a few solutions, you know, like the charcoal when you don't know what to do with your waste. If you could come up like with a list of these solutions that people, it's like a woman in a kitchen. You know, how do you make your sauce to taste so good? So this is what we want. We want those recipes. I mean, the WHO guideline, that's all very nice, but practically when you're in a crisis, what exactly do you do? So that's the first thing. And the second thing is, you are coming from the US, and there are countries that have found solution on how do they pay for their waste management. If you could just describe some example of countries in Europe or the US, where is that money coming from? Is it from taxes? Is it from the hospital general budget? And how do you make sure that you reduce costs in the waste management? If we could have a few paragraphs or a few lines, you know, even as bullet points, that would be so inspiring for the country groups. Thank you.
Okay, so country teams, you're reminded about regarding that templates that was sent out. Please respond to those questions. This, as you've been informed, was just laying the ground, but more discussion and engagements are going to continue, and we want them to be, you know, focused to the country needs. So provide that feedback, that will help the planning. So when you get your form back, your country team, then we will sit together and structure a way and then communicate it to you with the with the ILB team that has been presenting, and then tell you how we are moving forward, how you're going to be supported in terms of continuing the discussion around this money. So that form that was sent is very critical. Make sure it is back before the end of next week so that the planning on the next steps can begin. And then we shall reach out to you, especially the team leads, and communicate to you on the next steps on how we are going to be supported. Thank you very much. I thank all of you who have been on this call. I hope you have registered yourself so that we can keep track. Otherwise, all this has been recorded. We should be able to circulate it in the next few days. So have a great day, all of you. Bye-bye.
Thank you, everyone.
Thank you. Bye. Yeah.
Bye-bye.